Hello, I'm Dr. Yu. Today I'm here to discuss about substance use disorder, especially focusing on opioid use. In this presentation, we will cover the assessment and management of the opioid use disorder. The area which is important in assessment include a detailed history, examination, and investigation. The important area we will cover and the management, including intoxication and the management of the detoxification or the treatment of withdrawal. Here we can see that the history, we need to take the history of current use, the longitudinal history, which is actually the mode of onset, the course, duration, precipitating and predisposing factors, dependence criteria, complication including physical, psychiatric, and social complication. In history, we also need to ask for the comorbid conditions, the risk of intoxication, or any physical risk, or risk of suicide, or risk to other people. And it also involves a motivational interview, which later on guide us in the management of the case. After doing a thorough history, we need to do the examination. The examination include a mental state examination, general physical examination, especially checking for the needle marks or any skin lesion. Sometimes patient with present with systemic complication like hepatitis or other physical health problem. These patients have some cases have jaundice and other related issue. For that, we have to do a general physical examination and a systematic examination, including the cardiovascular system, abdominal examination, and other relevant examination according to the case. The third area in the assessment of substance use or in case of opioid use are investigations. In that case, we need to do certain biological investigation to check for the baseline functioning of the vitals organ like liver, kidney, heart, and the other organs. This biological investigation also include drug toxicology screen, which we commonly do urine drug screen. And the other investigation are psychological investigation, which are important like HOWS, that is clinical opioid rating scale, HOWS, that is objective opioid rating scale, and SOWS, that is the subjective opioid rating scale. These scales are important to titrate the treatment according to the withdrawal symptoms, and these are also important to assess for any improvement in the clinical picture of the patient. After taking the detailed history, a thorough examination, and the appropriate investigation, we have to manage the opioid use according to biopsychosocial model. But before discussing the withdrawal or the detoxification, I will like to highlight a very important area, that is the management and the identification and management of the opioid toxicity or intoxication. If there's any suspicious of opioid use and patient is present with symptom of slow breathing, constricted pupil, bradycardia, cold and pale skin, then we should suspect the opioid intoxication. The management is usually protecting the patient. It include the airway, breathing, and circulation. If the patient is not in the hospital, in that case, the CPR can be done in certain patient, and the patient should be shifted to hospital as soon as possible. And those cases who are in hospital, they if they present early, gastric lavage can be done. And the antidote, which is specific for the opioid intoxication, is naloxone, which can be given on IV or as well as IM. The management of the detoxification or the treatment of withdrawal symptom. For this, we have certain strategy. The mainstay of treatment is the opioid substitution treatment, which include methadone and buprenorphine. The other modality of treatment, which is called a symptomatic treatment, offering a patient to the uh, medication for pain relief and other complaints. The if we do the symptomatic management, there's another strategy which is called relapse prevention, which is usually given to prevent the relapse of the opioid use. And treatment for the complication, including the physical, psychiatric, and social complication. If we see the opioid substitution treatment, the methadone and buprenorphine both can be used. Methadone is a long-acting opioid or mu receptor opioid agonist. It's given orally. A dose titration is done according to the withdrawal symptom. The dose range is 120 to 60 milligram, but that is usually started with very low dose. That is with 5 to 10 milligram. Once the patient is stabilized, that occur usually within 6 weeks. A reduction strategy is followed. A rapid reduction strategy that is done for 21 days. A slow reduction that is for 4 to 6 months. The buprenorphine is a partial agonist on mu opioid receptor. The maintenance and dose reduction strategies are same as used for methadone. These are the opioid substitution treatment. In some cases, when the patient is not motivated to quit opioid, in those cases, for immediate relief of the withdrawal symptom, lofexidine like, which is an alpha agonist, can be given in some cases, but this is not an opioid substitution treatment. The other modality of treatment, which is called symptomatic treatment, and instead of giving opioid substitution, the patients are given treatment for GI upset, for problem like diarrhea, body aches. They are hydrated and given nutritional support and giving treatment for vomiting. A third strategy of treatment, which is usually discouraged nowadays, which is called cold turkey, in which the patient are kept in a place and not given anything. The treatment for the relapse prevention is called Nitric Zone, which is also an opioid antagonist. For a successful treatment of the opioid detoxification, it's important to give non-pharmacological treatment along with the pharmacological treatment, which can be in the form of psychoeducation, motivational interview, supportive counseling, cognitive behavioral treatment, narcotic anonymous or supportive group, social skill training, and harm reduction in certain cases of opioid use. I hope this was useful. If there's any question, kindly write in the chat box. Thank you for listening.